Meningitis is a dangerous illness that happens when the protective layers around the brain and the spinal cord become inflamed. One type of this disease is called meningococcal meningitis, which is caused by a bacteria called Neisseria meningitidis. This usually spreads from person to person through the saliva or droplets in the air, but in rare cases, it can also happen because of a poor dental care or a dental malpractice. So let me explain how this happens step by step by 3 steps. First, imagine a person who has a serious dental infection like a dental abscess or a gum disease that hasn't been treated properly. This might be because of a bad dental procedure, a poor hygiene, or ignoring early signs of infection. Second, when the bacteria from the mouth, that it's called oral bacteria, start growing and multiply. So these bacteria don't always stays in the mouth. If the infection is deep, they can enter to the blood, that is called bacteremia, and this is when the bacteria is present in the bloodstream. So the third step, once the bacteria it's in the blood, they can travel to other parts of the body, including the central nervous system, and this system includes the brain and the spinal cord. So the bacteria cross the blood-brain barrier, which is who normally protects the brain, and infect the meninges. The meninges are the thin layers that cover the brain and the spinal cord. So this is when the meningococcal begins, and the body starts to react with inflammation and also with symptoms that appear very fast. The person might get sudden high fever, stiff neck, a strong headache, and sometimes they can feel confused or sleepy. In some cases, they might also become sensitive to light, that is called photophobia, or even lose the conscious. So this whole process of a simple infection in the mouth can become into a life of threatening brain disease, and it can happen in just a few days if we don't treat on time. So why is this important? Well, because in many cases this could be prevented with a good dental practice, with a professional dentist that should always clean the area well, avoid the spreading bacteria, and treat the infections early. If the infection is ignored, the tools are not clear, or the treatment is not done badly, the bacteria can escape and cause very serious health problems like the meningitis. So that's why a regular oral hygiene, it's more than just brushing your teeth. It's about all your body, including your brain. A clean and healthy mouth lowers the risk of dangerous infections, and also visited a trained and careful dentist helps us to stay safe. So to sum up, meningococcal meningitis, it's caused by a dental malpractice. It's rare, but it's very dangerous. It shows how something small like a tooth infection can become a deadly condition if we not treat.
My name is Katia, and today we are going to talk about meningitis, how it's diagnosed, how to treat the symptoms, and how can we prevent it. So starting for the diagnosing, we have to follow a couple steps. For example, the symptom assessment and high fever, severe headache, stiff neck, nausea and vomiting, sensitive of light, confusion or drowsiness. In infants, we have to pay attention to some of the symptoms. For example, irritability, constant crying, and bulging fontanelle. We have 3 steps to follow in the physical examination. For example, examination of the neck for stiffness, neurological evaluation to check for the signs of brain involvement, review of the skin. We are looking for brushes, right? And we have the most important analysis For example, lumbar puncture, which is the most important method to confirm meningitis. And what does this analysis reveal? This reveals if the bacteria have a high number of white blood cells, low glucose levels, and bacteria visible under a microscope, or if this is viral. How do we know this? Well, if we have fewer white blood cells, normal glucose levels, and no bacteria. And we also have blood tests. For example, this is just because we have to see white blood cells count and other inflammatory markers. And we have imaging test, but this is only when we have a very severe case of meningitis, which is a tomography, right? And the symptoms, the more common symptoms in adults and teenagers are sudden high fever, headache that not improve, stiff neck, nausea and vomiting, confusion or difficulty for concentrating, drowsiness, sensitive to light, skin rash, seizures, and fast breathing. And we also have cold hands, feet, and pale or molted skin. And we can also have muscle or joint pain, but we also have some other important symptoms. For example, we have symptoms in babies and toddlers. For example, we have symptoms that might be harder to detect, but include constant or high-pitched crying, extreme irritability, excessive sleepiness, and fever, poor feeding, vomiting, and we can also have seizures. So how is the treatment? We have to use some intravenous antibiotics in some cases. We have, maybe if it's very severe case, we have to get on the hospital and we have to get hospitalization, maybe add additional support in the hospital such as oxygen, medicines for fever and pain, and in severe cases intensive care. But the most common treatment is antibiotics and rest, hydration, and pain relievers. So how can we prevent meningitis? Maybe, and the most safe way to prevent is vaccination, personal hygiene, and prompt treatment of respiratory infections.
Hi, my name is Monique Hernandez Vite, and I'm gonna talk about the relationship between medicine and dentistry. First of all, medicine and dentistry maintain a key multidisciplinary relationship as numerous conditions originating in the oral cavity, such as a dental abscess or periodontal disease. A dental abscess it's like an infection in the tooth that it's caused by a bacteria, and also it could start because we don't have the correct oral hygiene. And the periodontal disease, it's a disease that affects the bone, the gum, and the tooth. Why? Because if we don't have bone and if we don't have gum, obviously, the tooth it's gonna start moving, okay? Also, this periodontal disease starts because we don't have the correct oral hygiene, okay? The dental abscess and the periodontal disease can progress to an systemic infection. If we don't treat it correctly and at the perfect moment, it could progress to a system infection, as I said. Some oral pathogens, such as streptococcus, can spread and cause serious complications, such as a meningitis. By affecting the central nervous system. The presence of inflammation and other clinical signs should be considered in the diagnosis, as an odontogenic infection can represent a serious risk factor. As I said, if we have the correct oral hygiene, we can prevent all the treatment. If we have the correct oral hygiene, we can avoid the root canal treatment, the extractions, the fillings. We can avoid everything, okay? Preventive care, proper oral hygiene, and early detection are essentials to avoid the overuse of antibiotics and improve the patient's prognosis. Therefore, timely dental interventions not only treat local problems but also contribute to overall health, demonstrating that the connection between both disciplines is fundamental for a comprehensive approach to patient care. Okay? In conclusions, not only dentistry or medicine are important, all the disciplines are so important. We don't just have to take care about the oral cavity, we have to take care of all the system, of the heart, and everything. In the skin, it's also another part that we have to check. We have to check everything. We have to use all the disciplines to give to the patient a really good prognosis and the correct diagnosis.